And am I the only one that didn't know how crucial storytelling is in medicine? Let's dive into how to write a compelling medical narrative. We'll start with an engaging example. A 57-year-old Asian female with a 10-year history of rheumatoid arthritis developed severe neutropenia while receiving methotrexate therapy. The patient, who had been stable on methotrexate 15 milligrams weekly for 8 years, presented with fever and fatigue 3 days prior to routine laboratory monitoring. See how this introduction captures attention and provides vital context. It includes demographic details, sets the timeline, and highlights the key adverse event. Now about documenting medical history. Instead of listing conditions, weave them into a story. The patient's rheumatoid arthritis was initially managed with hydroxychloroquine, which was discontinued due to retinal concerns in 2015. Methotrexate therapy was initiated in 2016 with good disease control and no significant adverse effects until the current event. Her other medical conditions include well-controlled hypothyroidism since 2012 and osteoporosis diagnosed in 2018. When presenting lab data, clarity is key. Baseline complete blood count in January 2024 showed white blood cells 5.8x109L with absolute neutrophil count 3.2x109L. Upon presentation, white blood cells had dropped to 2.1x109L with absolute neutrophil count of 0.5x109L, indicating severe neutropenia. Finally, conclude with outcomes. Following methotrexate discontinuation and granulocyte colony stimulating factor administration, the patient's neutrophil count recovered to normal within 2 weeks. The event was assessed as probably related to methotrexate based on temporal relationship, known adverse effect profile, positive decal, and absence of alternative explanations. See, by maintaining scientific rigor and weaving a compelling story, you create a clear picture of an adverse event's development, management, and resolution. Happy writing!
As we reach the end of our journey through the world of pharmacovigilance, remember that you're now part of a noble mission, protecting patient safety, one case at a time. Every adverse event report you analyze, every narrative you write, and every causality assessment you complete contributes to the bigger picture of global drug safety. Think of yourself as a medical detective, armed with the tools and knowledge we've explored together. The WHO UMC criteria and Naranjo algorithm are your magnifying glass, helping you examine the intricate relationships between medications and adverse events. Your carefully crafted narratives are the case files that may one day prevent harmful drug reactions and potentially save lives. In this ever-evolving field, today's learning is tomorrow's foundation. The skills you've developed, from systematic causality assessment to precise narrative writing, will serve as your compass in navigating complex cases. Remember, behind every case number is a patient's story, and your diligence in pharmacovigilance helps ensure safer medical treatments for all. As you step back into your professional role, carry with you not just the technical knowledge, but also the understanding that your work matters. Whether you're analyzing a straightforward case or unraveling a complex web of interactions, your contribution to pharmacovigilance strengthens the global safety net protecting patients worldwide. Stay curious. Maintain your attention to detail and never stop learning. The field of pharmacovigilance continues to evolve, and you're now equipped to evolve with it. Remember, in the world of drug safety, your vigilance today creates a safer tomorrow for patients everywhere. Thank you for being part of this journey. Now go forth and apply these skills with confidence, knowing that you're making a real difference in the world of medicine and patient care. For queries on pharmacovigilance or medical writing, email us at medvigilance0@gmail.com. Join our YouTube channel, Medvigilance Insights, for weekly live Q&A sessions. Stay tuned.